could start asking
Okay, yes.
Esther and Cindy about their experience in physical activity with pancreatic cancer patients. I have read the paper at the Journal of NCCN, and I know it very well. And it really helped the patients. Their quality of life increased very much, and the final results were encouraging. So I would like you to comment on the people who want to drop out of the program, and how can you convince them of getting in again? So this is one thing that I am sure that you have to face, and how can you solve that?
Thank you, Alfredo. I think that we have more of a problem of patients who don't want to try enter the program than patients who drop out during the physical activity. Of course, when we have a disease progression and the general status degrade, they are not fit enough to continue. But most patients, Esther, will talk under your control, but I think that I will say that 80 to 90% of patients, they truly feel the benefits of physical activity. And once they have started, they realize that it's good for them and they want to continue. And we have very few patients saying, yes, I've tried, but no, it's not for me. I don't like it. I think most of them, when they have the right professional to accompany them and to adapt the program and to bring them motivation, they really like practicing. I think that this issue, it's more when they don't have a human going with them through the physical activity program. I mean, when then the patient are just directed toward videos to look at, and the doctor will say, look at these videos on YouTube to practice your exercise. This is very bad for the motivation. I think we need to have social interaction, human interaction, in order to get involved. But when you have this kind of organization, I think most of people, they don't drop out from the program.
Thank you, Cindy. This is a very relevant message.
And we see it when we make the physical activity assessment with the 6-minute walking test. Sometimes a patient start and say, I'm not going to be capable to make it today. And when they finally do it, and finally feel by themselves that they are better, only after 6-minute walking, this is they change their mind about physical activity. And also, in addition, who Cindy said, I think that it's important to empower patients to take their responsibility for their own health. Most of time during my consultation, I tell them we can do a lot of things for you in terms of medication, but we cannot do physical activity for you. That this is the only thing that you can do for you, for yourself. So I think that it's important to say this message for them.
Yeah. Thank you, Esther. Rohini, you have a question? Yes, please.
Yes, can you hear me?
Yes, very well.
Thank you. Thank you for this amazing presentation. And I just wanted to ask, for me, after Whipple surgery, it was, I used to do like not intensive exercising, but yoga all my life, and also some other cross fitness exercises. And I had to start all over after my Whipple surgery. I couldn't really do the asanas that I could before. And even now, what I find challenging is that when I ask a physiotherapist or a kine about what why these poses I'm not able to, like, I don't feel comfortable, or to what extent can I go in these asanas, because it can be intensive as well. I don't get responses as such. So I'm still struggling to find who should I go to really for who may be able to guide me, and who understands, about, who has some knowledge of, let's say, cholangiocarcinoma or pancreatic cancer and Whipple surgery. Yeah.
That's a very good point that you raised, because indeed, physical activity professional is a healthcare work that is just growing now. We are in the early years of this job. And so, as you clearly said, it's not the same to have pancreatic cancer after surgery or to have breast cancer after surgery. You're not in the same state of mind. You don't have the same physical limitation following the surgery, etc. And so for them to develop an expertise, they need to get familiar with the different type of cancers. And so that's why I think we truly need to have them during their training to work in a close interaction with medical departments to learn exactly what is the trajectory of the patient, what are the consequences of the surgery, what can be done or not. So by talking with the surgeons, etc., in order to have more experience and expertise to give advice then to patients, as you said. And so I think it's difficult for them because for most of them, they just have theoretical basis about physical activity, but they don't have a deep practice. It's the same as for medical doctors. You need to see many patients in order to be familiar with a disease. And so I think it's more maybe by talking to the MDs, the doctors who care about you. Maybe they know a physiotherapist or a physical activity professional with who they are used to work, and so they have learned exactly how to manage this kind of situation. But it's true that if you go and see a physical activity professional who is specialized in breast cancer, he will not be, or in obesity, because they are also not all focused on cancer. Some of them are doing other medical conditions. It might not be appropriate to have the best advice. So I unfortunately, I don't have an answer to your question. So about who could be the best to help you, Esther. I don't know what is your feeling about that, but we are also with Esther struggling to find the right professionals when we don't ask people working in our department as physical activity professional. It's difficult to know outside of the hospital who can be the professional we can make the patient go and ask outside of the hospital.
Yes, I completely agree. We have less literature and data on pancreatic cancer patients, so we build it together and we work a lot of in a little network between us. We research together and we answer questions together, but there are a lot of things that we don't not really know yet.
Yeah, thank you to both of you. There are a few questions in the chat. So one question for Marlene, questions about evaluations of the physical program. What are the most important factors to check? Maybe Esther or Cindy?
But there are in the physical assessment, we have to check at least muscle condition with the test if we don't have the other machines, but at least we have to make some tests to evaluate if patients are sarcopenic or not sarcopenic. in the global assessment, we have to check if there are not major contraindication, as Cindy says, for example, cardiologic contraindication, and other comorbidities. I think for us, like as nurse, we can check, and that can be make a special link with patient if we check the motivation and the barriers to physical activity, not to a sport, as Cindy said, to physical activity. With that, I think that we can start to counseling a program. Cindy, if you think that
Yes,
that's...
I totally agree. And I think if the question is about how we re-evaluate the patient to know whether we are effective or not, I think that, as you say, it's the same simple test in terms of 6-minute walking test or on grip. We know that they are well correlated with the risk of complications of the treatment, for example. And so that's why our message is keep simple. Do it systematically, but keep it simple to be able to do it systematically. I think that's an important message.
Yeah. Okay, thank you. Iga, please.
Thank you. During your presentation, Cindy, you mentioned motivation, and having heard about the Radek's story, in his case, motivation was probably one of the most important factor, because he really wanted, and he was also supported. So also this factor is very important. But actually what he did was when he left the hospital, and then what he did was during his stay at home and his motivation, support from the family, from his friends, etc. But one of his part of the story is swimming. So especially the problem for pancreatic cancer people who are after the surgery and they do not have pancreas, so it's insulin pump. So have you ever had any experience with this kind of problems for the patients, because you probably rather worked with them in the hospital? So what's your opinion about this? Because this is particular for the pancreatic cancer patients.
So you mean about the swimming practice, or
Yeah.
about dealing with the insulin pump?
Both at the same time.
I have a solution actually, because I can disconnect insulin pump, and I can explain it. Look, that this is connection, yeah, but
Yeah.
you can disconnect this connection and tape it by special stretch foil around stomach and around sensor on the arm.
Okay.
Stretch foil is the best solution.
Okay, so you've got
And,
already a solution, but from
yeah,
the physician story, from the
2 days ago, I swim on the ocean and also in the swimming pool. So it's the perfect solution in last 2 years.
Okay.
Stretch foil for packing something.
Okay.
Thank you, Radek. Cindy, do you want to comment anyway?
I think it shows that activity can be adapted.
Exactly.
To make it
So if you want it, you just do it. Maybe it's not so simple, but you need to have a really good motivation. Thank you.
Okay, so we have time for one more question from the audience. No other question?
I would like to ask Radek that just answered to the last question about the insulin pump. I remember from your daily plan that you have dinner at 14 hours, and then you have breakfast at 6 a.m. So do you fast from 14 hours until 6 a.m.?
I can explain it. Now I moved breakfast time to 9 a.m. Yep. But 9 a.m. is the first breakfast. Second breakfast, little toast, for example, or apple, is on 11. 2 p.m. I have dinner, and after this I have a little second dinner at 5 p.m. and about 7 p.m., 8 p.m. I had supper.
Okay, you forgot to include that in the slide. That's nice. Yeah, thank you.
During my trainings, it could be banana or something I prepared at 5 a.m. Of course.
That's good. Yeah. Excellent.
Thank you. So thank you, Radek, for explaining this. And there is a technical questions. If the recording will be accessible, yes, it will be. Porna was you asking. It will be accessible. Well, not immediately. We need them
Now,
to edit. Yes, sorry,
now I
Radek.
am okay.
Yes, okay. Go ahead.
Now I am Luisa. Sorry for interruption. In this time, just now, I am preparing a helpful support book for somebody who has a problem with pancreas or without pancreas. It would be a form of ebook supporting somebody about physical activity, about eating, about insulin pump, all these problems from my history, because I am a tester of solutions. 1 week ago, I had a presentation for diabetologists in our country. How to be supported in diabetic problems without pancreas.
Yeah.